So as we continue our look at the COVID-19 pandemic now 5 years later, there is a chance you may know someone who's still fighting lasting effects from that infection.
I do, in fact. It's called long COVID, and it is very real. Senior health correspondent Monica Robbins joins us to explain. My mom was dealing with that. She had long COVID symptoms. This is the first winter in which she hasn't had a long-term respiratory illness.
Yeah.
And the guess is it was long COVID.
Yeah, that's one of the things. That's definitely one of the symptoms. You know, about 2 years into the pandemic, we started hearing more and more about people who were dealing with symptoms long after their COVID infection had disappeared. Brain fog was probably the most common, but we also reported on stories of people who lost their ability to walk, had heart issues, memory problems, breathing difficulty. The symptom list is very long and varied. Long COVID is a very real diagnosis, and people are still being seen at our local hospital COVID clinics.
They think that folks that are more at risk for contracting COVID may perhaps get it more often. So those that have, heavier chronic health problems, older, certainly are more at risk. But one of the things that we found, even with our clinic and in the numerous studies that have been done worldwide, is that anybody can get it, from kids to adults. So even healthy people who had very minimal forms of COVID can get it.
Now, a study out of Yale indicates long COVID may have a significant economic impact. About 20 million American workers have been diagnosed with long COVID, and about 3 million may have needed extended absences from work. And the study also surveyed 3,500 long COVID patients and found nearly 1 in 10 suffered from 5 or more persistent symptoms. These individuals, including young, previously healthy adults, were twice as likely to be sidelined from work compared with those with fewer symptoms. And experts say the COVID vaccine is still the best way to prevent long COVID. And even though the newer variants are more mild, the more times you've had COVID increases your risk for long COVID symptoms.
Wow.
Even if you're over it, if you're still getting COVID, you still run the risk.
You know, my husband has it, and it's so random because he can go mountain bike, but he gets winded going up the stairs of our house.
Really?
It is so bizarre.
Yeah. And that's one of the weirdest things about this virus, is that the symptoms were so diverse. You could have a family of 5 and each person could have COVID and everybody would have a completely different symptom.
Yeah. Incredible. What a time.
Yeah.
Monica, thanks.
Sure.